Without any further ado, moving on from this morning into our next item, we have the wonderful Heather Kean, the Director of People and Culture for TNG Global. If you put your hands together for Heather, thank you. Supporting RSE worker wellbeing.
Hello. That's one of the rare times that someone got my last name right. So it's Kean that looks like Kean. Right, TNG. So many of you will know us. We are a business of scale. We have two key businesses. One is TNG Fresh, and the other is our apples business, which takes premium apples to the world. So in terms of our RSE workforce, they sit across Fresh. So we have RSEs in Northland and in Auckland, and we have RSEs, a big component of RSEs in Hawke's Bay and in Nelson. So the case study I'm about to talk you through, which we're very proud of, is from the Hawke's Bay. So this is an initiative that came from the Hawke's Bay, and it came because that's where our largest population of RSEs are, and we had challenges with our amazing pastoral care team who were spending a huge amount of time taking RSEs to local doctors, sitting for hours on end in waiting rooms, and just a level of care that was tricky and a bit compromised. So our RSE team, and in particular our health and safety team, so it was health and safety and our RSE team, that took an initiative. Oh, actually, let me start. I always do this. I get right to the end and I haven't turned the page. So we've got around 800 RSE in total. There's about 4,000 RSE in Hawke's Bay itself. So this initiative that I'm going to talk to you about was an initiative that we opened up to all of the RSE employers in Hawke's Bay. So whilst we initiated it, the real opportunity came because it could be delivered at scale. So we talked about the challenge, so long healthcare waiting times. It was just a really inefficient model, and our pastoral care teams were spending a lot of time in waiting rooms, as were our RSE workforce, and in cars. So all the implications of that. So what we wanted to do was make our healthcare services to our RSE workforce more accessible and way more efficient. So those are the two key drivers of where this initiative came from. So what we did was we approached the Hastings Health Centre, and it took us a bit backwards and forwards before we really got engaged in a decent conversation. But ultimately, they also saw the benefits of this because it was a population with quite specific needs, and if they could also concentrate the way that they offered their service to us in a more efficient way, there were real benefits for them as well. So benefits for us, benefits for other RSE employers, and definitely benefits for Hastings Health Centre. So we ended up in a combined cooperative situation with them, with the insurers, with ourselves, and with other RSE employers in the region. So we ended up opening up the clinic at our site. So we have a clinic that's run from 7:30 in the morning till midday, Mondays through Fridays. We have two paramedics that work, and it's the same paramedics every time. So we've got two people who understand the environment that these people are working, that our RSE workforce are working in, and there's a real rapport and insight and knowledge, and it kind of has loads of benefits. So Monday, 7:30 to noon, and it's accessible to all 4,000 RSE workers across the Hawke's Bay. It's working, like it's successful, and it's definitely addressing the issues that were resulted in us coming up with this initiative. Most common reasons for visits: musculoskeletal pain. So often we're talking, these are workers inside our pretty extensive orchard operation, skin infections, flu-like illnesses. We also, as it was developed, ended up establishing a kind of a side clinic that's actually held at Hastings Healthcare, but specifically targeted at our RSE workforce for chronic illnesses. So when we have people that have underlying heart conditions, diabetes, stuff that's not in that first group and the kind of, immediate interventions, we're able to give them much more dedicated support around preventative care, ongoing monitoring. So we had this bit that blew out of the program that was really targeted at chronic illness. We introduced Heidi, and someone put these slides together for me, and when I was preparing at 8 o'clock last night, I thought, what's Heidi? I don't know where Heidi is. So I now do. So it's AI. So when the two paramedics are working in the clinic, they can just speak. So AI basically, all of their case notes are done in the clinic, verbally captured, so they're not having to do it. So it's a really efficient process. I'm assuming that other doctors do that as well, but it's an initiative that was included in the clinic. So an average of 24 patients per day. At peak season, they're seeing 40 per day in that 7:30 to midday period, so it's pretty busy. 29 different RSE employers, so there's been a really big uptake from the wider community, and we've had remarkable feedback on it. I'll talk about that in just a moment. And during that peak, we are able to bring in additional support. So too dedicated, and we can bring in additional people if need be. We run an Ask for a Team survey, certainly this year, with our RSE workforce, so got some pretty amazing results. Overall, we've got some pretty amazing results, but in terms of 99% of TNG RSE respondents feel supported to look after their physical health, 96% know how to get access to healthcare. So it's just made the kind of the supply chain, if you like, from an event through to support, through to recovery, that much faster. And just a really efficient, so long as you've got a reasonable scale, a really efficient solution to a common problem across all of us. So wait time is significantly reduced. Continuity of care, so the same people looking after them. See, this is what I do. I think I've already done this slide, but I'll keep going just in case I've missed something. Just a really seamless process. So from the two paramedics that understand the environment, that are seeing all the common issues and the stuff that works and the stuff that doesn't, just a real efficiency in the way that that's getting serviced. Very positive feedback from both the RSEs, the employers and the healthcare providers. It's been a real win for Hastings Healthcare. I'm going to tell you about an award that we've won shortly, because that was pretty exciting, particularly for healthcare. And it's eased demand. This is the community piece. It's really eased demand in the waiting rooms. So that's been a real win for the urgent care, kind of off the street situation in Hastings. So it's made a big difference to the waiting rooms. Just wanted to quickly run through a case study. So again, this is just knowing where to go, having quick access to services. So we had a situation, I mean, we've all got these stories to tell, but we had an RSE worker with chest pain, came to the clinic. It was in the right time zone, thank goodness, supported by people in the workplace, was recognised, diagnosed as a heart attack immediately. So treatment on site, helicopters, taken to Wellington, procedure done, really successful, and we returned to full health and was able to, get back into the process. So, yes, it was because we had medical healthcare on site, but I think the real opportunity was that everyone knew what to do, where to go. It was like not coming to family, but it's a known process. Now, on the right-hand side there, we've actually won. Hastings Healthcare, us and the insurance company, there were some awards in Hastings, and there was something like 13 nominations for this initiative for the local primary healthcare awards. It's sort of like the Academy Awards in Hastings for healthcare people. So it was 30 nominations is quite a big deal in the small community. So it's kind of recognised as a great initiative that's working for people. So we're certainly going to continue with it. So to confirm for 2026 season, I mean, I can't see us ever not doing this, really. The clinic is at our site, it's in our training room. So sometimes when there's big crowds, there's a bit of an issue about making sure that we've got enough room and people are, it's not kind of getting in the way of the work at our pack house. But those are very minor problems to be dealing with. We think it's the first. I don't know if anyone else has seen one. We're pretty sure it's the first, certainly in our sector. And we do think there's the opportunity for it to be replicated in other regions. But my real message is it's a cooperative process. So if, as a group, Nelson's an obvious place where it may well be an opportunity for you, but you really want everyone to be involved so that you get the win-wins through it. But we certainly think it's a massive one. That was something we wish we'd thought of years ago, to be honest. So we were keen to share our insights about that, and with the hope that you might think about doing it in your own regions. That's me. Happy to take any questions. Oh. Yeah, that's coming, just behind you.
Thank you. First of all, congratulations, just sensational. I look forward to replicating it in Wanganui. But the query I was going to... we probably don't have the scale to replicate it there. The big question that was going in my mind, it was a huge number of RSEs, like half of all the RSEs had a doctor's visit. Has it been considered possibly what can be done to reduce the number of doctor visits in the first place? Now we've talked about this before, never achieved anything. As a small RSE employer on our own, we can't. The big players like you can. The sort of things we've thought about is we know that most of the medical issues we get for our people are actually diet related, due to diet. However, when we put up our translated to Samoan from the Heart Foundation suggestions for diet, waste time. We've often thought a video by a Samoan talking in Samoan to Samoans, how Samoans talk, i.e. it's a bit of fun because it's how they respond and listen. If we start talking about if you eat the big Coke, you end up with the big belly, which means that your mate will call you pregnant and all this sort of stuff and have a big laugh. It would do really well, but it's just a case of, I'm assuming that every RSE employer probably has that same concern, the same issue. Is there a way for a big company like T&G, just like you have there, helped everybody else in Hawke's Bay, come up with a video? Because the same videos can apply to everybody. The only difference would be language, I think. Yeah, totally. So what do I think? I mean, videos are great, but there are, that's a one-off event, hey? So I don't think that's the panacea to the issue. I think team leaders play a really, really important role in this, in terms of speaking in the various different languages and playing a really active role. So I think that we certainly work, and I understand that at scale we have more opportunity to do this. But I do think that using leaders from within their own community is a really important way. So you educate that group, and then they play a really critical role with the bigger workforce. I think that's really important. I think that in terms of the diet, the chronic clinic, I know it's different because it's a subset that already have issues, but there's some pretty intense stuff that can happen through the clinic. Musculoskeletal stuff, we've had some really good initiatives
with a physio on site. So again, I understand that when you're smaller, that's harder to do, but if you can do it across, a couple of employees, that's made a massive difference. So in terms of our health and safety numbers and our health and safety events, physio on site, warm-up exercises before the shift starts. So we probably had more success in that musculoskeletal space with those two initiatives in particular. And that was, you could see it in our health and safety stats. It was just a big difference when we implemented that initiative. And then diet, catch me afterwards. I'll have a chat with Nikki and see if we've got anything exciting that I'm not aware of. But using the team leaders, I think a video is great, but it's a one-off event, and you really want the message to be reinforced over and over and over again.
One more question from Mr. Martin.
Thank you for the very good presentation. Now I just need to make sure, how can you expect us liaison officer to work together on this? Because it sounds like you're reaching out to the communities while we're still on the ground providing our service, not as just pastoral care, but also ensuring the well-being and welfare of the workers, just to make sure that we're on the same line. Because if worse comes to worse, is that somebody admitted and need insurance coverage and medical plan, it will always fall back to us. So I think the expectation is how we can work together, not just TNG, but other companies. We can work together on such matters, so we can make sure that we protect and also raise awareness on the integrity of RSE. The second part is that, do we have stats and data on team leaders that pay extra for extra representative versus those with no payments? Thank you.
Thank you. So in terms of the first question, so yes, that's a good point. And certainly the liaison officers, I think we have very strong relationships, and I know that's an incredibly important part of our broader community in whānau. And I'm certainly aware of a number of events where we've had our liaison officers working very closely with us in particular events. So I think that's a point taken, good point. I'm sure we can do better, as is always the case. In terms of the team leaders, certainly there's I won't comment on wages, but certainly in terms of support, there is a significant training, development. It's an important role. It's a really important role, and we're very committed to the investment in that group, in that community. I'll probably leave it there.
Any other questions?
Sorry.
Another one?
Yeah, second part. Actually, how would you be able to communicate these sort of services amongst the other employers? Because one of our employers that work closely with Samoa and are very dear partners of Samoa, they have competition on preventative competition, and it's very well distributed and well aware by everybody. It's really it's good to see this very often, and also the competition amongst the on OSH equipments, OSH wear. There's also Best Driver of the Month. They do that normally and this is all on safety side of things.
Is this in the Hawke's Bay?
Yes, and she's sitting right in front of me. Sorry, Karen. This is Thornhill. It's well communicated, these preventive actions and also the initiative to push for safety workplaces. So how can you communicate yours? Because this is the first time I've seen TNG, because we also want to promote it amongst our workers, totally. And also to ensure that they read this during the pre-departure orientation. Thank you.
Thank you. And well done. That's I think you just answered this man's question. So, in terms of the preventative stuff, I do think that, stuff like The Greatest Loser, healthy eating, I think you put a bit of competition into it, and it's a great way to get engagement, and it's a great way to drive change and educate, I guess. How do we promote it? Couldn't quite remember the question. So this is only our first year. So this is very new. And one of the ways that we can communicate it is to present at the RSE conference in 2025. So here we are. And but I'm there are, if you haven't heard of it locally, catch me afterwards and we can have a chat. But I think that word of mouth is by far the best. And certainly in Hawke's Bay, I think we've got a pretty strong community down there. But there will be other ways that we can do it. I mean, it's something we probably should take to the the regional group and then get it back into the national group. But really the hope of sharing it today is both as a user of it, but also are there other areas where we think that this could be an initiative that just takes a few people with a bit of initiative and a kind of a commitment to it, but it pays back tenfold.
Thank you. Okay, let's put our hands together for you.
Thank you.